my favorite laser technologies is the use of a C02 laser, which is a specifically designed laser that targets water in the skin to help basically resurface the skin in addition to cause improvement in collagen building. It really affects a wide variety of different issues related to skin aging, in particular, fine lines and wrinkles, when the skin becomes coarse, so the smoothness of the skin. It's a great treatment for pigmentation, so when we get extensive sun damage. And if you look at a younger child versus, say, an adult, what you'll notice is that the appearance of the skin has a lot to do with, the individual looking more rejuvenated and youthful. So if you look at, say, one of my younger kids' skin, you see that the skin is smooth, no pigment changes, no fine lines and wrinkles, and that's where the CO2 really excels. It really helps to address almost all of those things at once. And so at our practice, we have a specific CO2 that has 3 different levels. And, the first level is traditionally performed by an individual, more like an esthetician. And it's really what I would call a superficial laser peel, just to help debride or help remove some of the outer layer of the epidermis and just help brighten and freshen the skin. The mid-level and the deeper level, which is kind of what we label them as, are a fair amount more aggressive and either performed by myself or one of my physician's assistants. And it's a great treatment option to really kickstart or jumpstart rejuvenation of the skin. So for the mid-level range, generally they're done in a series of about 3, and there's a little bit of downtime of a couple of days. We do those series over the course of several months, traditionally done in the winter, not during the summer, because we want to try to avoid sun exposure after the procedure. But it's a great way of improving some really fine lines and wrinkles and specifically pigment. When patients have extensive facial aging, where they have a lot of coarse lines, particularly around the mouth and the nasolabial fold region, then we usually will resort to a little bit more of an aggressive treatment. So that's kind of the 3rd level, so to speak. And traditionally I do that in the operating room when the patient's sedated, because it's a fair amount more uncomfortable. The downtime is more extensive, usually a couple of days to even up to 10 days. But the ability to rejuvenate coarse lines and wrinkles associated with aging is extensive, and it's just one of my favorite laser treatments for sure. So I generally recommend patients come in and start on some skincare, do the laser treatment, and then just continue with really good skincare afterwards, and they usually have a really successful outcome.